Okay, so next I'm going to go ahead and assess for cranial nerves. First, I'm going to have you close your eyes, please. And we're going to test the first cranial nerve. Go ahead and block one of your nostrils for me and tell me what you smell.
It smells like garlic.
Very good. It is garlic. Next, go ahead and cover the other nostril and tell me what you smell.
Alcohol.
Very good. It is an alcohol wipe indeed. So her cranial 1 nerve are intact. Next, I'm going to check her second cranial nerve, which is the optic cranial nerve. I'm gonna have you look into my eyes and go ahead and tell me when you see my fingers.
There.
Good.
There.
Good.
There.
Good. So her second cranial nerve is intact and that there is no peripheral disturbances and she's able to see my fingers. Next, I'm going to check the third, fourth, and sixth cranial nerve, which is the ocular motor, trochlear, and abducens nerve. So I'm going to have you follow my finger with your eyes only. Very good, so that is intact. And I'm going to check for nystagmus. Excellent. Next, I'm going to have you look straight into my eyes. Good, and I'm looking, her gaze has not shifted on either eye, so those nerves are intact as well. Next, I'm going to do the fifth cranial nerve, which is the trigeminal nerve. And I'm going to palpate your temporal and TMJ muscles. Go ahead and clench your teeth for me. Okay. So they are firm and symmetrical. And then next, I'm going to have you push forward. Good. And push backwards. And then to the left. And then to the right. Very good. Next, I'm going to use the check your sensation. So this is what light touch feels like. Okay. This is sharp, and then this is dull. Okay. So go ahead and close your eyes and tell me what you feel.
Light.
Good.
Light.
Good. Excellent. Next sensation.
Dull.
Dull.
Ooh, it's pokey. I don't
Okay.
remember.
So
what the
sharp.
choice was.
Good.
Sharp. Dull. Sharp. Dull. Sharp.
Good job. Okay, so her sensation there is intact as well. Next, I'm going to do the seventh cranial nerve, which is the facial nerve. So what I want you to do now is give me a big smile. Good. Give me a frown. Good, very good. Next, give me a surprised look. Excellent. And lastly, this one's kind of challenging, but give me a shocked look, like you're shocked. Good. Very good. So that nerve is intact. Next, I'm going to do the eighth cranial nerve, which is the auditory nerve. And I'm going to go ahead and perform a Weber test. So with this test, I'm going to tap this fork and I'm going to put it right above your skull. And you tell me if you hear it in both ears and when you don't hear it anymore, okay? You hear that?
Not anymore.
You were hearing it?
Yes.
Good. So no hearing loss is noted in either ear. Next, I'm going to do the Rhine test. And I'm going to do the same thing, but this time it'll be on one side of the ear, so we'll test your left side first. Same thing, tell me when you hear this.
Okay, I don't hear it anymore.
Very good. So her air conduction was twice as long as the bone conduction, so her left side Ryan test has passed. Same thing on your right ear. Tell me when you start hearing it, when you stop hearing it. You hear it? Good.
Okay, I don't.
Don't hear it anymore. So air conduction was also twice as bone conduction, so the Ryan test on her right ear is also passed. And next, I'm going to do the 9th and 10th cranial nerve. And for this, I'm going to do the glossopharyngeal and vagus. So first thing I'm going to do is open a brand new tongue depressor. And I'm going to check the back of your mouth and stick out your tongue and say ah. Good, so the uvula is moving and no abnormalities there. And next I'm going to, I'm going to have you take a sip of your water and swallow it. Good, so she had no difficulty swallowing her water, so her nerve is intact. And then next I'm going to check your gag reflex. So go ahead. Sorry, this is a little bit uncomfortable. Go ahead and open your mouth. Very good. So her gag reflex is also intact. Next, I'm going to check her 11th cranial nerve, which is her spinal accessory nerve. So I'm going to have you shrug your shoulders for me. Okay, so it's equal strength bilaterally. And then I'm going to have you turn your head to the left against resistance. Good. And then to the right. So it's equal in strength bilaterally. And next, I'm going to do the 12th cranial nerve, which is a hypoglossal nerve. And I'm going to check your tongue symmetry. So stick out your tongue and put it side to side. Excellent. Close your mouth, and I want you to push your tongue to the left side. Good. And then other side. Excellent. So her 12th cranial nerve is also intact. Thank you so much.